Honorable Ministers of Health and Members of Parliament from across the globe, Dr. Jane Carter, President of the Union, scientists, global public health leaders, healthcare professionals, and community members gathered at the Union World Conference on Lung Health. My name is Amitabh Bachchan, and I am a TB survivor. And I would like to tell the world that I too was diagnosed with the disease in the year 2000 when I was hosting a very popular show on Indian national television. I had tuberculosis of the spine. Recent reports highlight that this form of tuberculosis can pose serious occupational problems with the risk of neurological complications. My diagnosis took a lot of time and the treatment was long, but I was privileged to have a good doctor and access to good advice, love and support of my family, and I could recover completely from tuberculosis and get back to work. I understand that this is not the case with several others who get TB. They don't get to know whether they are suffering from tuberculosis, TB, or MDR TB till it is too late. Even the treatment is tough as they may not have access to proper TB drugs or may discontinue treatment because the side effects are harsh. This battle against TB is not easy. In all humility, I would like to say that while it is true that TB disproportionately affects the poor, those who are from lesser means, but it is also true that not only the poor suffer from tuberculosis. Forgive my modesty when I say this, but if it can happen to me, it can happen to you, it can happen to anyone. If my saying that I too have been a TB survivor can help those affected with the disease and give them confidence that this is completely curable, then I would like to say this openly. Here I am, a TB survivor. Unfortunately, people who have had a TB have faced stigma and discrimination and have been shunned by those they work with or seek care from. Stigma only makes it harder for people who are suffering to disclose their illness, making them feel isolated and alone in their battle against the disease. TB patients must not be stigmatized. They must get the support and care they deserve. Only then can we end tuberculosis. If my saying this can help in any way, then I'm happy to lend my voice to the campaign to end TB. I have pledged my support to the Indian government's call to action for a TB-free India and shall continue to work with them till our country has achieved this goal. I congratulate the International Union Against TB and Lung Disease for bringing together over 4,000 participants from 130 countries to find a solution to end this disease. Each of us has a role to play. We need our political leaders to commit at the highest level in each of our countries to provide that much needed services to the most marginalized and vulnerable populations. We need to pool our resources to find effective solutions. And yes, we need much more investment in research. We need new diagnostics that make it easy to detect TB and new drugs that can shorten the course of treatment. And most importantly, we need an effective vaccine. I was with the US Ambassador to India, Mr. Richard Verma, and Sri Ratan Tata at the launch of the Call to Action for a TB-Free India campaign in Mumbai. And I'm happy to convey to you that I stand committed to making a difference, as I've done before in my long association with the polio campaign till India was polio-free. I'm with you all in this fight. TB harega, desh jeetega. Thank you.